Let's move on to our third chapter, how to optimize every doctor visits. As a chronic constipation patient or any chronic disease patient, it requires more than just showing up for the doctor's appointment. It requires active preparation and participation. In fact, it requires us to be leading that doctor's visit so that we can make every doctor visit count. Today, in this chapter, I'm going to talk about few tips and how to navigate the doctor's visit. Number one, want to start with the time constraint. Number two, talk about specialized test. Number three, I will talk about 5 tips to prepare well for doctor's visit. And then I want to talk about 9 different scenarios in which we can talk or prepare better. Let's dive in. Let's understand the time constraint. In the US, there is a data that says doctors have on an average 8 minutes to have a conversation with their patients. In that 8 minutes, they have to ask questions, they have to ask for treatments, they have to do a diagnosis and prescribe. Meanwhile, they need to document as well. And in this fee for service model, the healthcare system incentivizes the doctors to see more patients and prescribe more procedures instead of prevention. So I have nothing against the doctors. I'm sure most of them have the best intentions. But my experience has been that my doctor's visits were rushed. I had few questions in my mind. Because of that fast-paced environment, I forget things. And after the appointment, I always have a nagging feeling that, or a regret that, oh, I should have asked those questions, but I missed it. Now I have to wait for the next visit, or I have to Google myself. So that's not a great feeling. In order to avoid that feeling, I think it's best to prepare well in advance. And when we understand that there is a time constraint, I think it's best to prepare a list of questions one by one. It's something like whenever you go for a professional meeting, what we have is we have agenda, we have follow-up questions, what goal that we have in our mind in order to make this meeting successful and outcome. I think it's the same with doctor's visit as well. And in fact, when we are well prepared, what we are doing is we are making the doctor's life easier. I think it will make it easier for them to document, easier make them to identify patterns, triggers, and what's working and what's not working. It also makes their life easier. So therefore, and they'll love you because even in that particular space, 8 minutes on an average of time, they can spend more productive time discussing the root causes rather than having a superficial conversation. Not only a superficial conversation, but also a superfluous conversation because there may be repetition in what conversation they have had in the past. And if you spend more time repeating the same questions again, discussing the same issues again, we are not moving forward. So, in order to optimize for that 8 minutes or a short time period, and for some doctor may spend more time with you, but in general, that's the average. We can prepare well in advance what question to ask, what outcome we want from that visit, and not have a regret that, oh, I should have asked those questions later. So that's understanding time constraint. Advocating for specialized test. I mentioned earlier chapter that as a patient, we got to be like MMA fighters. We got to demand, we got to assert, and the test is one of them. So as chronic constipation patient, we may be in a different spectrum of severity. For that different for that different spectrum of severity, we may have different causes, and that causes can be only identified through different tests. For example, if you have a gut motility issue, then you have to take gut motility check. If you, yeah, because of other medications, you need to take the test for other medications as well. So for example, it's because of the thyroid, then we have to take a thyroid test. So to identify the root cause, these different tests must be necessary, but those tests will not be the standard operating procedure and will not be prescribed to you. And obviously, as a patient, we cannot prescribe the procedures or test ourselves, but we can discuss and advocate that with our doctor. And for that, we need to research what are the latest therapies, latest treatments, latest tests, and so on, so that even the doctor is aware of what what tests are required for us, and we got to advocate for ourselves. Let me give you a simple example, my experience. So I learned that vitamin D has a great impact on digestion, inflammation, and gut microbiome. But when I went through my annual test, so vitamin D test was not in the panel, and I requested for the vitamin D test. And when the result came, I had vitamin D deficiency. And it's obvious that I would have vitamin D deficiency because I have been living in Boston, which is more northern latitude, and we rarely get enough sun rays, enough sun, and especially me, working from home, working from offices, the desk job, I really go out on the sun to get vitamin D. And also, not only that, I have more darker skin. That means I have more melatonin to get enough vitamin D than I to get outside the sun for a longer period of time. And I'm susceptible to vitamin D deficiency. Had I not researched about vitamin D, or had I not researched about what could be a possible cause of chronic constipation, I would never know, and I would have never brought that vitamin D with my primary care doctor or my gastroenterologist. And when it came out low, a deficiency in vitamin D, I started taking supplements. And it's a fairly inexpensive supplements that I started taking. And guess what? It started improving my chronic constipation. It started reducing my inflammation. And that's what I mean. We got to advocate because we live with our body 24/7. And we know if we observe properly, if we document properly, we will know the different patterns. And also, if you research properly, we will know what could be possible reasons. And again, we can start with low hanging fruit. For me, vitamin D taste was the low hanging fruit, and I got tested. I got deficient, even though it was not in a standard operating procedure. I think that's why it was not included in the panel, and I requested for it and got it, and that helped me. Similarly, for your severity, you can identify what could be a possible cause. For example, if you have a gut motility issue because you have an urge to go, but if you can't go, but if your transit time is longer, so that could be issue and you want to get tested. For example, if you're gaining weight, then thyroid can be one of them, and because thyroid can also cause chronic constipation or digestive issues, so you can get tested that. Again, documenting all of these will help you to test, so advocate for it, for a specialized test if you need it. And I'm going to talk about different tests to diagnose the root cause of chronic constipation. I'm in the next episode, I'll go one by one, so stay tuned for that. Now, let's talk about how to prepare for the doctor's appointment so that we can make the best out of every doctor's visit. We have already talked about how doctors are extremely busy, how they follow standard operating procedure, and we may be out of that standard operating procedure. Therefore, it's our duty, responsibility to advocate for us. So, in order to advocate for our own health and make the best of doctor's visit, here are 5 things I recommend. Number one is documenting the symptoms. Number two, researching and listing questions. Number three, listing medication and supplements. Number four, discussing diet and lifestyle. And number five, being clear about the goal. Let's go detail in one by one. Number one, documenting the symptoms. So we need to keep our detailed record of our symptoms. When it started, when it ended, when it exasperated, when it lessened, all of these things. And when we record these in, in addition to our diet, in addition to our bowel movement tracker, and in addition to our treatment trackers, adherence to treatment, then what it will give is a rich data for our doctor to analyze the data, understand the pattern, understand triggers, and be able to make an informed decision about the diagnosis or test the doctor can recommend. Without these continuous and insightful data, for doctors, it will be very difficult to diagnose it properly and even prescribe. So when we do present the data to the doctor, we are actually making their life easier. And number two is researching and listing questions. We talk about we have to be scientists of our own body. We got to be the MMA fighters in doctors so that we know what's the newest treatment, newest test, newest diagnosis, newest things are available. So that when we meet our doctor, we can discuss about whether that's a possibility, whether those kind of treatments, tests, diagnostics, medications, everything would work for us. At least we can talk about those things. Otherwise, in the absence of research and absence of that proactiveness, we may not even talk about that. And as rushed as the doctors are, even though they are the most well-intentioned doctor, it may be missed. So it's on us. Similarly, about listing questions. What question do we want to ask depending on what the goal we have? I'm going to talk about the goal a little bit further down. Then we will not have to regret that we didn't ask those questions. This researching and listing questions are like preparing for the meeting. So in a professional setting, what we have an agenda, we have the key evidences, we have key statements, data points that we prepare in advance so that we make the most productive out of that particular meeting. I think this framework that this is another productive meeting that we want to have, and we can prepare as much as possible so that we can be most informed about it and we can add value to the other partner. Our meeting attendees, in our case, our meeting attendee is our doctor, and how can make his or her job easier and faster and better so that it make the most productive out of it. So research and listening question is absolutely essential. And number three is listing medications and supplements. I didn't know this, but different supplements and medication we can take have adverse effect in our chronic constipation. The reason why is our body is a complex machine, and one thing it does can impact other things. I'll give a very small example. Iron supplements can cause contribute to chronic constipation or constipation, right? It, we may not correlate with these two independent things, but actually it's not independent; it's correlated. So when we list, okay, these are the supplements that we are taking, these are the medications we are taking, these are the new supplements we are taking, these are the supplements we stopped taking, these are the doses we added. So and then we can track that with our symptoms, our bowel movement, bowel biomarkers. Then it's also very clear, rich, real world evidence for our doctors to take it as an input in their decision making heuristics, right? That will also be really helpful to recalibrate the treatment plan, recalibrate test plans, and help them to diagnose the root causes of it. So always list medications and supplements and proactively communicate that to the doctor. And even better is collecting that with the symptoms, the diets, and lifestyles. That was super important. And number four, prepare for discussion on diet and lifestyle. As we know, diet and lifestyle are huge for chronic constipation, right? If I start eating high fiber food with some fats and some protein, and I stop eating the processed food, then my chronic constipation ele- alleviates. It's become better. So there is a direct correlation, and we can check that with our bowel movements as well. For example, when I use the Bristol stool chart, it becomes incrementally softer stool, easier to evacuate, less pain, no symptoms of bloating or no symptoms of pain or bleeding. So that's progressively goes away. So I know that. So we actually have to discuss very precisely about our diets. Although what I also learned was that surprised me was doctors don't have to study much about the nutrition, but they study a lot about the treatments, interventions, but about not about the prevention. That surprised me as well. But at the same time, it's very useful to discuss diet. And also for chronic constipation, lifestyle has a huge impact. For example, stress can induce constipation. Your travels can induce external factors like travel can induce constipation. And then uh, your sedentary lifestyle can cause constipation, right? Your if you have hours to go, but if you cannot go, then it could be also be the pelvic floor dysfunctions. Then if you can be neurological dysfunctions. When talking about all of these lifestyles and when the symptoms started, documenting, and then that will also be the rich uh, data points for your doctor to prescribe. Then they can evaluate that, analyze it, and present us what the best thing for us to do, what helps us, what hurts us, what works, what doesn't work. All of those will be based on the real world evidence. And number five, so we got to be clear about our goal. And I talked about different severity spectrum. So when I was having strong chronic constipation. I was bleeding. I had hemorrhoids and fissure. At that point in time, only thing that I worry about was how do I get instantly better? At least stop that. Right? So if my goal is to stop the pain, then we can talk about how stop the. We can talk about that. Talk about okay, my goal is to stop the pain. What can I do in that scenario? Okay, the stool softeners or other diagnoses like the immediate relief plan would work. And then after that's done, my goal is now prevent it. So preventing meaning I don't want to focus more on the medication side of I want to focus more on the holistic side of it so that I can prevent in the long term. And after that, if my goal is to now live a highly performing life because I want to increase my uh, health and longevity, so that my goal is completely different. My questions are completely different. So based on the goals that we have, we should prioritize our question based on the different severity of spectrums. We can classify the questions, prioritize the questions, and then goal is to progressively become better and move from higher severity to lower severity to no then disease free, from disease free to having high quality life, and then we can plan for our for different stages of our goals. And it's not going to happen overnight. From having a severe pain to no pain and very high performing life, it's not going to happen overnight. It's going to take number of years or months. And the reason why I'm creating these videos is also it doesn't have to take years. Maybe these education, these frameworks will help you reduce the the recovery cycle from or getting a real diagnosis from years to few months and recovery cycle from years to few months. That will be help me get very good satisfaction that my journey is being useful to someone. So these are the five different tips or to make the most out of your doctor's visit. I know it seems a lot of work, overwhelming, but if if you think about it, it's spending a few minutes per day recording bowel movements, researching questions, listing medication and supplements, what are diet and lifestyle discussions, and what are goals. It's just spending a few minutes per day. And when we take the risk and benefit analysis, spending just few minutes per day, taking control of our own health, that's the benefit, right? And the cost is that's the cost, and benefit is that we got to live the symptom free. We got to get the right diagnosis. We got the right treatment plan. We get the we have to spend less because now we need to go visit doctor less, and more importantly, we get to live happy and healthy life. So few minutes is the cost, and benefits are exponentially higher. So it's worth it. Now that we have talked about those five tips to get most out of our doctor's visit, let's also walk through different scenarios. I'm going to talk about quite extensively 9 different scenarios, and I don't think we will walk through all of those scenarios in depth. We'll just list few of them and see how we can make the best out of those visits. Number one is preparing for your first primary care visit. So always make the best questions. And again, be very careful about asking for what is covered and what is not covered. And obviously, if you are going after symptoms, it's not worrying about the payments per se. It's about getting better. And again, listing the questions, listing the symptoms, when it started, when it worsened, listing light and lifestyles, and being proactive and communicate that. Number two, the annual physical exam. So in annual physical exam, we need to talk about new symptoms, changes in existing conditions. We also have to talk about preventative screenings appropriate for our age and our health status. For example, in the United States, like if you're now for colorectal cancer, colonoscopy is 45, it used to be 50. So we can do the cost benefit analysis. And if you have more gastrointestinal symptoms, you can get tested and for screened and test for different particular diseases, which we are going to talk about in separate episode, which is going to next, the test for chronic constipations. And when you're going to first specialist visit also, most of the things are similar. We can talk about symptoms, research the test, and many other things that we talked earlier. And be the routine specific follow up. We want in the routine ones we want to we want to add things such as before and after, because in our first specialist visit they're going to talk to you about different treatment plans, different lifestyle changes, prescriptions, and so on. Then we can take a note about how easy what is there, what happened after adherence, and we can compare before and after our first specialist visit. And then in our second appointment, then you can our doctor can calibrate. And sometimes we also want to get the second opinion appointment. In my experience, it's quite difficult to get in the US, but if you manage to get one, you want to take all of your previous medical history or test history, medication history, supplement history, or treatment history, diagnosis history, all those together, so that you can get a very thorough second opinion. And if it requires pre-surgical or any procedure, we want to do the risk benefit analysis. For example, in the United States, the colonoscopy is prescribed so often, and there is also criticism that uh, colonoscopy is overprescribed because it's a procedure and health system can generate revenue out of that. For most people, if there aren't symptoms, if there aren't family history, most likely it's unnecessary. So I'm not a doctor. Please consult with a doctor. In my case, I genuinely felt that my colonoscopy was not necessary because I didn't have a history of the family uh, family of cancer. None of my family member had. So even my symptoms were mostly the hemorrhoids and the fissure, bright red. Other than my chronic constipation, I didn't have any other diseases. So directly jumping into colonoscopy was too soon. I felt, but again, that's the cost benefit analysis and risk reward analysis you must do, and also ask for complications. That's what we want to talk about. Post surgical follow up. If there any recovery to be done, how to recover faster, you can ask a lot of questions about that. What a diet, what should do, should not do. After in my colonoscopy experience, after colonoscopy, I didn't get anything about this is how I should recover, and I should have asked. Right, it's on me to ask, and if you ask for that, then I should even call about, okay, when weight loss started happening, I could call a doctor and say, okay, this is the reason why I did not do that. I didn't know I can do that. So this is the reason why I'm creating the absolute should and able to do a post follow up as well. And number eight, again, managing chronic conditions. So everybody is different. What works for one person may not work for another person. Hence, it's absolutely essential to list down all the symptoms, diets, and treatments. So we can do a thorough scientific analysis, the real world evidence based analysis that what works for us, and so we can work personalized and holistic point of view. And and when we go and visit our doctor, we can present so that our doctor can give us a personalized uh, treatment plan than just a generic treatment plan. And number nine is when satisfied with not satisfied with care. Again, for many reasons that we may not like our doctor, sometimes the way they talk, sometimes that we feel like they're not listening to us, and sometimes some of the doctors we find it great. And as a patient, we deserve a provider or doctor who we can be comfortable with, and we can be always friendly and politely say this doctor is not working for us, and we can advocate and be assertive for finding someone new, right? And when you go and find someone new, as I said, remember the five things I talk about. What's your goal? Document the symptoms, document your treatment, research the treatments, research, uh, get the medication supplement list, and talk about extensive diet and lifestyle. So if you do this, right, every doctor visit, we can make the most out of it, and we don't have to regret, oh, I missed this question to ask, oh, I felt rushed. So we don't have to uh, make mistakes or miss something out just because we are not prepared. We don't just show up, we prepare, we participate, and we lead, right? So our doctor is help us to get better. We do not outsource our health to the doctor. Doctors and any other medical system are there for as a tool for us to get better. And we must avail every resources and tools that we have, obviously at a cost that's affordable to us. And talking about affordability, I think financial aspect is a crucial one. And I also want to talk about the financial aspects of it, how to navigate that. That should be the critical part of navigating the US healthcare system. That's the next chapter we are going to talk about.